Just before Roisin takes you through the detail of the campaign, which is obviously the interesting bit, I just wanted to give you a little bit of context around this. And particularly as a starting point, I wanted to acknowledge all the really great work that is going on in the sector. Sometimes when we launch something as exciting as this, a project like this, we tend to think, oh, this is a first step. Actually, this is just a natural progression from the work that's been done by many of the people in the room and that is ongoing today and last year and for many, many years before. So I just wanted to acknowledge that before I started. Again, as Stephanie alluded to, communications campaigns are one part, an important part, but most effective in the context of a suite of measures. And we have already outlined and alluded to the other measures, including legislation, internal measures within the agency across the healthcare service. So this website sits within that framework, and its specific target audience is the 1.34 million harmful hazardous drinkers. Now, you would have seen, those of you who are familiar with the HRB Alcohol Diary Survey 2013 will recognise that profile of people who are drinking probably a bit too much, a bit too often. For many of these people, they don't really realise there is a risk to alcohol. They may be on the path to causing themselves harm, or the harm may already have occurred, but they haven't really noticed it yet. So that lack of understanding around risk is something that we really want to tackle specifically with this. I mean, some of you will have heard the first radio ad that went out this morning that is around breast cancer, and that's a good example of where the Healthy Ireland survey of 2016 indicated the very, very low levels of awareness of the link between alcohol and breast cancer. The actual figure was only 27% of women were aware of this, and I think this is definitely a statistic that most women would like to be aware of and need to be aware of, and that's why that's formed one of the key messages of this campaign. The other piece of information I think that isn't out there so often is the level of support we have from the public in terms of both the government and the state to address the issue of high alcohol consumption. That sometimes gets lost in the debate around policy. Again, the HRB Ipsos Mori survey, now as far back as 2012, shows over the quarters of the public support the state, the government, in taking some action around the high level of alcohol consumption. Also in that report, 72% of people reported that they knew someone in their group who, in their opinions, drank too heavily or had a problem with alcohol. And within that group, 42% of those people reported it was a family member. And again, you will see reflected in the website the concerns of family members about other people's drinking and how that impacts in a family, that the sections of the website are responding to that and trying to connect people who have those concerns and worries with the services that exist for them. Finally, I think for all these campaigns, you need a little bit of luck for them to connect with the public, but also you need for them to be timely. I think this is particularly timely because there has been much media discourse about policy and legislation, but I think the most important fact that we have at our disposal is that last year, in 2016, alcohol consumption went up just under 5%. I think the very positive economic recovery is certainly driving alcohol consumption up, and it underlines the role of affordability in this. But an increase of our alcohol consumption now is just over 11 litres. What most people don't realise when we talk about alcohol consumption is where it ought to be. So the target we have within Healthy Ireland is just over 9 litres. So it's important that people see that in the context that to anchor where our drinking ought to be. So we are actually just over 2 litres above pure alcohol per capita above where we ought to be. So there's quite a lot of work to be done. And even I think if the public were aware of the fact of that, it would be very helpful to them because heavy drinking is quite normalised in Ireland and we need to try and challenge that. So we hope that this website, we're asking a lot of it, that will do all sorts of different things, but certainly it will provoke conversation. It will certainly give information and enable people who want to manage their own relationship with alcohol and are interested in managing their own health, give them the tools at their disposal to do so. So we hope it will be a resource for the public, but also very importantly for health professionals and all of you working in the sector, because we know there are various initiatives that will be taken internally across the healthcare services that will help people to support people in managing their risk around alcohol.